Hello, good evening, everyone. So, I hope you are fine and in sound health. Today we gathered here to discuss the for the newly passed students that who passed just recently in the June batch. And in my teaching session, actually, we had a lot of success. Around 98% of my all the students who passed part one exam. So I did a surprise station for them, and also it will be broadcast in YouTube, so that later on you can see this session. Okay, and if you have any question, you can ask, because it is Zoom session, so open for all. You can ask if you have any question related to AKP today. Okay, is that fine? So how I organized my lecture today, that is AKP session. Okay, so I hope the screen is okay with you. So as you all know, most of people actually know me by the name that I am a teacher of MRCPCH Part 1, and recently I have started AKP batches also. One batch is successfully going to finish, and the next batch will be in October. So let us start our session today, and in between any time, if you have any queries regarding AKP, please do not hesitate to ask me. Okay, so as you all know, like MRCPCH part 1, AKP also has two parts. Okay, in the morning paper 1 and in the evening paper 2, two exams in each session. There are three sessions per year, like January, May, and September. And due to this COVID, uh, nowadays most of the MRCPCH exams, theory exams, are going on with online. But many MRCPCH exams, like clinical exams, also going on online. In 2020, UK started this COVID online exam, clinical. So this is a great opportunity for many of us who have no center in our countries. We can take this opportunity. But how long this clinical exam will be online, this actually we are not sure. Maybe it will be stopped, and face-to-face exam will start soon. But the theory exams are still going online, so you can take the good opportunity. Okay, so many of you have many questions like AKP, because part 1 is well renowned, and many teachers are there, but AKP teachers are very few. And AKP examination, many of you do not have clear idea how the exam pattern and how the exam going on. So MRCPCH AKP actually questions are also very much varied. Like some paper you will got 55 question, some paper you will got 56 question, like this, around 50 to 55 6, like this question. Okay, so question varies. Okay, it is not fixed, and time is fixed 2.5 hours, so around 150 minute you have to answer around 58 question. So at the beginning of the exam, what you do, you see the how many question is there. Okay, and then you divide with the time. Okay, divide 150 minute, and last 10 minute keep yourself to see the flagged question. As you all know, you have passed part 1, so you all know there are flag system. So before 10 minutes of finishing the exam, you must keep 10 minutes in your hand, and then 10 minutes you will see the flagged question. That will be helpful for you. But remember one thing, that first question is always, first answer is the best answer. Okay, because when you read the scenario, you have a differential diagnosis in your mind, you have a management in your mind. That is the best option actually. So if you change the answer, most of the chances are there that it will be wrong. Okay, so first impression is the best impression. Okay, So now come to the question pattern. How many question and what are the question? See, most of the question will be single based answers, like MRCPCH part 1. Most of the questions are single based answers, but there will be some question like extended matching question. Okay, so they will have 3 scenario and many answer. You have to choose in between them. And there will be some question that has multiple answer. That means one single question, but they will ask you 3 or 2 differential diagnosis. Suppose they will give you an investigation x-ray report and with a scenario, suppose foreign body. So they will ask you what is the most two important management in this child. So management is ICU admission definitely, and rigid bronchoscopy definitely. So like this one, there will be 2 answer. So what will happen if you give one answer and you do not give another answer? So you will get half mark. Okay, so remember that MRCPCH AKP is a tricky exam, not like part 1. It is not like single based answer or EMQ. No, there are different question pattern. Some question will have 2 answers, some question will have 3 answer. So what I will suggest you, whenever you will see the question, please look at carefully how many answer they are asking. Okay, now time is 2.5 hours. This you all know. 3 session per year. Like in the part 1, it is 1 month ahead. Like part 1 is February, so part 2 AKP is January. Okay, 1 month ahead. January, May, and September. These are 3 session per year, and now online exam is possible, and you can see the fees and dates, near dates in the www.rcpch.org. Okay, if you have any question you can ask, because this is open session. Most of the people actually are watching in YouTube, but I will invite you to join in the link below. Okay. Okay, so now applied knowledge in practice. This is called AKP exam. As you all know, AKP comprises 2 papers, each of which are 2.5 hours and then taken on the same day. So that is paper 1 and paper 2 will be same day, and there will be 2.5 hours gap in between the exam. And this part of exam, applied knowledge, what is the difference between AKP and part 1? See, in a part 1, the most of the question were theory based. Okay, what is the investigation, what is the management, like this. It is only theory based. But part 2 is your interpretation skill. That means when you see any question, that means when you see any x-ray or you see any ECG, you can interpret. So part 1 and part 2, there is a little bit difference. Okay, someone is asking to full. Okay, so I'm slideshow, slide. Okay, now the screen is okay, I hope. So the what is the difference between AKP and part 1? AKP exam is basically you have to interpret your investigation. Like when you see any x-ray, when you see any ECG, you have to interpret what is that, what is the diagnosis. They will give you audiogram, they will give you MRI. Okay, they will give you EEG, ECG, CT scan, anything. Any investigation can be given. So you have to prepare yourself that what is the diagnosis of this condition, and you have to keep in mind some differential diagnosis, like 1 2 3 differential diagnosis of that condition. Okay, now each question will be a case history. So if you are given if you are given any x-ray or any ECG, it should not be without any scenario, because without scenario interpretation is very difficult. So they will give you a short history. It can be 4 line, 5 line, 6 line history. They will give you some vital parameters. Sometimes they will give you the blood gas, or they will give you the electrolyte parameters. Okay, so by this investigation, by this history, can you manage the patient, can you diagnose the patient? This is actually the AKP exam. But part 1 was not like that. Part 1 is not so much interpretation skill. Part 1 was theory based exam and basic management, like what is the management of febrile convulsion, what is the management of celiac disease. So part 1 was clean cut, clear cut question. But AKP, you have to make it more precise, and you have to make it more interpretation of the data. Okay, just 1 minute. Okay, so any question until now? So let us see our next question, that is the most favorite question of every student, that is how I will get the materials and what is the resources. So preparation time is around 5 to 6 months. It depends actually. Okay, I gave exam after 6 months of passing my part 1. So it depends. If you are a middle grade registrar, or you are working as a uh, senior grade doctor, then it will be hardly more than 6 months. Not more than 6 months, it will be below 6 months. But if you are working as a trainee, or you are very junior, you just pass internship, you just pass your MBBS, then you can take a little bit more. That means 8 months or 9 months you can take. But I will suggest that if you pass part 1 already, if you passed, then there is no delay, you should not delay. Within 6 months you must give AKP. Clear? Because the knowledge is fresh. So best is, whenever you got your result that you passed part 1, then and then you just. Okay, if you have any question, please you can open your mics. Okay, now next is, so this is about the preparation time. Now next is uh, the the book list actually very long. Okay, in the part 1 we had 4 or 5 books mainly, but in AKP it is not so. It is at least 20 materials you have, at least 20 types of books you have to read. And plus you have to read the AKP cases book, you have to read the FOP cases book, task cases book. Okay, so list is a little bit long, but already you have read many books, like Red Book Pediatric Guideline, Survival Guideline. Okay, some of you have read already Neo Format book, Science of Pediatrics boxes. Some of you already read the AKP cases book. Okay, so the new books are, for some people, like Neo Format book is the new, and AKP cases book is new, and also these data interpretation books, because we did not read data interpretation in part 1. Okay, and also uh, this radiology book, that is the radiology book. It is actually, we did not read radiology book. So this radiology book you have to read by heart, from the core of your heart, because this radiology for MRCPCH and FRCR, this book is very very authentic and very good book. Okay, even in UK the trainees, radiologist trainees, they read this book. So I think you should read this book at least 2 times. Okay, there are some books, that is get through MRCPCH part 2. These books are mainly for clinical, mainly for photographic book. Okay, but these books are very very old. So the management portion, these books like towards MRCPCH or get through MRCPCH, these books actually published in the year 2008 9. Okay, so at least 14 years old book. So do not rely on these books. Okay, best source of photograph is the Google. When you see any child, suppose you are seeing the photograph of a Turner syndrome or Noonan syndrome, okay, or a pedigree, just look at the Google, that what are the other features of Turner syndrome, what are the other features of Noonan syndrome. So best is Google, and in every condition you have to look several times, repeated, so that your brain is accustomed with the features of a syndrome. Okay. Now, as I said, these get through books, data interpretation books, these are very old. So there are some mistakes, because previously we gave what we gave ACTH in case of West syndrome, but now what we give prednisolone, steroid. So the management actually changes in every 5 year. There is a major change in management in many disease. So if you read 10 years old book, then it will be actually not good for you. Your knowledge will be backward, so it will not good. As I said, Google photos from Google is very good. I used to do this thing. Now, the pediatric guideline, that is red book and blue book. Neonatal guideline is the blue book. These two books are highly recommended for all parts of MRCPCH. Okay, read the latest edition, 2021. It is latest edition, pediatric guideline red color and neonatal guideline blue color. So these two books, what will happen if you continuously reading these two books, you will be habituated with the UK management. And also your part 1 AKP and clinical will be very smooth, because all these three parts are related with these two guidelines. Okay. Now, there are some teachers who made notes like Mustafa Al Baba sheets, and these are very old also. You can read this if you find this in the internet, in the my Telegram channels. If you find this, you can read. But mainly, I will recommend these guidelines: AKP cases book, survival book, also FOP and task cases book. Okay. So some guidelines are not present in the red or blue books, like management of refeeding syndrome, management of MCARD, okay, mm, uh, management of what I say that chronic asthma, okay, management of chronic diabetes, okay. These things are not present in the guidelines, so you have to download. Celiac disease is not present in the red book, so you have to download the nice guideline from the internet, and then you have to read it. Okay, in our teaching sessions, usually I make notes, small notes for my students, and they are benefited actually. So I give daily basis some notes every day. My students are here, they can tell you better that I give voice notes, sometimes I give handwritten notes. Okay, small topics, these are very important for your exam. These are called tips for the exam, or this is called high yield topics. Now, question bank, you have to read one time at least before you start your books, because you should accustomed with the system of the MRCPCH AKP. Like, we have many question bank on exam, past test. You can subscribe online, past test. They are very cheap. I think 100 or something dollars like this. So you can subscribe this, and you can get recent subscription. Also, in many groups you will find it free. Okay, in I have some channels, you will find it. If you search, you will find it free. And sample papers. Okay, so sample papers is very important. Okay, any exam like part 1, part 2, or clinical. In clinical also we have some sample questions, sample formats. So sample questions are very important because they are released by RCPCH, and they are actually good, very good. They are authentic question, so you can go through the sample paper of RCPCH. Okay. And exam recalls are important, but remember, AKP, they actually change the question. So you read recall, of course you read recall, but do not rely only on recall. Some people will tell you that only recall is enough. No, actually no. You have to read the basic books. Okay. Any question until now? So this we already discussed. Single best answer. This is the question pattern, extended matching question. And some question will be similar to single best, but there will be 2 or 3 answer. They will tell you that how many diagnosis, they will tell you that this patient, this scenario has write down two differential diagnoses. Okay, suppose the x-ray ECG can have two answers. And as you all know, AKP and part 1, you can give anyone before and after. I mean, there is no serial. So AKP you can give now, and before part 1 also you can give, and after part 1 also you can give. But the main point is, before clinical exam, you have to pass all the theory exam, FOP, TAS, and AKP. Okay. So these things we already discussed, that MRCP radiology book is very important. And new format book, I told you already, new format book, actually this is a scenario based book. Scenario based book means this book has the interpretation skill. This book has many scenario, many history on examination, on investigation. So new format is a practice book. If you practice it daily, one chapter, one chapter, one chapter, then it will be very, I mean, you will be very quick in answering the AKP. So I think you should read this new format book at least 2 times. Okay, so every book, like radiology book, new format book, AKP cases book, every this book you have to read 2 times, 2 times. Now some students actually asked me about my channel, so these are the channels. Okay, first one is Telegram, second one is in the Facebook, third one is in the YouTube, and these are the groups that where I notified the meetings and everything. So you can take this screenshot, and you can later on participate on these channels, so that you can get update about my next meeting or next free sessions. Okay, now these are the books for needed for MRCPCH AKP, like Red Book Pediatric Guideline, then Blue Book Neonatal Guideline. Okay, then Statistics for MRCPCH. Okay, Radiology book, Clinical Cases book. Okay, then Practice book, then New Format. So these are not all. Okay, there are many other books, like for ECG, EEG, audiogram, pictorial book, pedigree, data interpretation book, recalls, and sample papers. So all of this together will be your AKP exam. Okay, there will be at least 54 to 58 question in each paper, and the questions are mixed. Systems are mixed, like in paper 1, this is not divided with endocrine, neuro, not like that. So it is actually mixed. You will get endocrine question in both paper 1 and 2. You will get neurology question in both paper 1 and 2. Okay, so what is our target? Our target is, this is a very good degree, post graduation degree in UK and also in other parts of the world, like in Gulf countries, in Bangladesh, Pakistan, India, Nepal, Sri Lanka, Malaysia. Okay, in Asia also, this has a high value. So I hope this session was a little bit helpful for you, and in future also I will take more sessions that will be very uh, good for you, and you can get free guidance. So if you have any question, you can ask. Okay, then I will stop the live session, and